This is Dr. Christy Del Castillo-Heggie, co-founder of the Fed is Best Foundation. On September 22, 2017, senior members of the Fed is Best Foundation met with top officials of the World Health Organization Breastfeeding Guidelines Program, Dr. Nigel Rowlands, Dr. Lawrence Grimmer-Strawn, and Dr. Wilson Werr. Fed is Best Foundation advisors in attendance were myself, Jody Seagrave, co-founder, Julie Tibbetts, pro bono attorney for the foundation, Dr. Brian Simon, Hilary Kosteba, and two invited guests, a neonatologist who works for a leading U.S. hospital that is baby-friendly, and Dr. Paul Thornton, lead author of the Pediatric Endocrine Society Neonatal Hypoglycemia Guidelines. This is a presentation I gave during that meeting. We have convened this meeting to discuss very important issues regarding infant feeding that affects millions of families in the developed and developing world. The importance of this meeting cannot be overstated. How we teach mothers to feed their children affects whether or not their newborn is hospitalized for feeding complications, whether their babies experience days to weeks of hunger and thirst, or whether they are safely and fully fed. Whether they experience brain and life-threatening complications and subsequent disability and even death, or whether they are able to lead a healthy and independent life. Safe infant feeding is perhaps the most critical way we preserve health and human potential. At this time, feeding complications from exclusive breastfeeding are the leading causes of newborn hospitalization and disability in the world. It is our foundation's mission to eliminate accidental infant starvation and the brain injury and disability it causes. We do this by investigating the science of infant feeding, breastfeeding complications, and perinatal disability, and by re-educating mothers and health professionals on the definition of ideal infant feeding. We have no financial disclosures. The Foundation has not and will not accept donations from any infant feeding companies, both breast and formula feeding companies, in order to provide unbiased advocacy and education on safe infant feeding. Today we'll discuss feeding complications in breastfed newborns and its root causes, the incidence of complications and hospitalization from insufficient feeding of exclusively breastfed newborns, newborn brain injury and disability from breastfeeding complications, the global epidemic of neonatal jaundice, dehydration, and perinatal brain injury from insufficient exclusive breastfeeding. And finally, we'll discuss preventing feeding complications, newborn brain injury, and disability. Given the widely known benefits of breastfeeding, rates of exclusive breastfeeding initiation is increasing in all hospitals across the globe. The 10 steps of the World Health Organization Baby-Friendly Hospital Initiative is the protocol used to promote exclusive breastfeeding of newborns. Step 6 of the guidelines recommends giving infants no food or drink other than breast milk unless medically indicated. Because of this guideline, we are seeing increasing rates of neonatal morbidity and hospitalizations for complications related to underfeeding of exclusively breastfed newborns. How do these complications occur? We have thousands of stories posted on the Fed is Best Facebook page and website by mothers all around the world, but the common theme in all the stories are summarized by the following mother. I was made to feel that breastfeeding was the only way to feed my child. My child suffered from lethargy, jaundice, and hypoglycemia while still in the hospital. The most widely publicized case of accidental newborn starvation was the case of Landon Johnson, who showed obvious signs of hunger and distress for 2 days while in the hospital and went into cardiac arrest 12 hours after discharge due to hypernatremic dehydration from insufficient exclusive breastfeeding. The complications associated with the accidental starvation of exclusively breastfed newborns are well known and include dehydration, excessive weight loss, hypoglycemia, hyperbilirubinemia, and hypernatremia, all of which make up the syndrome of starvation. Starvation results in injury to the brain and vital organs, and if uncorrected, leads to loss of vital signs and death. How are exclusively breastfed newborns underfed, and why do exclusively breastfed newborns lose weight? Some newborns are born too sleepy to latch. Some have difficulty latching and transferring milk due to anatomical reasons, poor coordination, and suck. But the majority of insufficient feeding is caused by not enough breast milk. The daily caloric requirement of a newborn to feed all their living cells is a minimum of 100 to 120 calories per kilo per day. For an average 3-kilo baby, the daily caloric requirement is 300 calories at birth. This is the published average daily colostrum production of healthy, vaginally delivering mothers on the first 4 days of life, and this is the number of calories that colostrum provides. The number of calories provided by the average mother provides roughly a tenth, a third, and then 2/3 of a newborn's caloric requirement for the first 3 days of life, finally exceeding the full requirement on day 4. This is a graphical representation of the number of calories an average mother can provide a 3-kilo newborn, the blue representing the number of calories colostrum provides, and the red representing the number of calories a newborn requires additionally to be fully fed. Only on the 4th day does an average mother's milk provide the full caloric requirement. Until that time, a newborn is fasting and relying on internal reserves to feed its vital organs. How does the newborn respond to fasting? The newborn loses weight. Weight loss of exclusively breastfed newborns has been widely taught as fluid loss, when it is in fact caused by receiving a fraction of their daily caloric and fluid requirement. An exclusively breastfed newborn relies on the onset of his mother's copious milk production in order to be rescued from this fasting state. How many babies have to fast longer? In a study of 280 healthy mothers delivering term babies who are well supported with lactation services, 22% or more than 1 in 5 mothers had delayed onset of copious milk production, and their babies were 7-fold more likely to lose excessive weight. The leading risk factor for delayed lactogenesis is being a first-time mom, which was confirmed by another study showing that 42% of first-time mothers had delayed lactogenesis. How many exclusively babies develop excessive weight loss? Because of the high rates of delayed lactogenesis 2 and the low caloric and fluid yield of the average mother's colostrum, it is common to lose excessive weight and develop the related complications of hypoglycemia, hyperbilirubinemia, and dehydration. The largest study of exclusively breastfed newborns showed that 10% of vaginally delivered and 25% of cesarean-delivered exclusively breastfed newborns lost excessive weight of greater than 10%. Therefore, the leading causes of newborn hospitalizations are complications associated with insufficient feeding from early exclusive breastfeeding. This is data showing the most frequent causes of readmission for one large U.S. healthcare system were for feeding problems and jaundice. The American Hospital Association's data on U.S. neonatal readmissions showed that the principal diagnosis for 48% of all neonatal readmissions in 2009 was for jaundice. Among all the readmissions, 78% of newborns received phototherapy. The literature estimates that 86% of jaundice admissions result from non-hemolytic or starvation-related jaundice. Since the publication of exclusive breastfeeding guidelines, hospitalizations for neonatal jaundice and dehydration have risen steadily. Neonatal jaundice is the leading cause of newborn hospitalizations in the world, the majority in underfed breastfed newborns. It is also one of the leading causes of perinatal brain injury and developmental disability in the world. 1.1 million newborns will develop severe jaundice every year, the majority in resource-poor countries with insufficient healthcare resources to monitor breastfeeding complications, combined with increasing avoidance of supplementation previously used to prevent starvation-related complications in the first days of life. 114,000 newborns a year will die from that severe jaundice. The remaining survive their jaundice with varying degrees of developmental delay and disability. Hannah Awadsi is a professional journalist in Ghana who is determined to exclusively breastfeed her firstborn daughter, Avery. She developed jaundice by day 3. Avery was found to be severely dehydrated, hypoglycemic, and had hyperbilirubinemia of 30 milligrams per deciliter by day 11. Avery subsequently developed cerebral palsy. I was told to continue to breastfeed. Meanwhile, the milk was not flowing. She couldn't latch on for hours. She was never satisfied. She couldn't sleep. Milk started to flow later, but it was not enough. No mention was made of supplementation to reduce jaundice. Jaundice is very common in Ghana, and a majority of children with cerebral palsy in Ghana suffered jaundice. What I am suffering now cannot be measured compared to feeding the baby with formula. I wouldn't wish cerebral palsy on my worst enemy, especially in our part of the world with very scarce resources to help such children. Many parents end up wishing their children dead or even killing them. What does hyperbilirubinemia do to the brain? The epidemiological data shows that hyperbilirubinemia of greater than 15 increases the risk of multiple developmental disabilities, including ADHD, cerebral palsy, seizures, language delay, deficits in motor, sensory, visual, auditory, behavioral, and cognitive development, also known as bilirubin-induced neurological disorder, as well as frank kernicterus. A long-term 30-year follow-up study of newborns with bilirubin levels of greater than 20 showed that 45% had long-term neurobehavioral problems, including higher rates of ADHD, difficulty with reading, writing, and math, and inability to complete high school and college, as well as increased rates of alcoholism. It has been estimated by the Academy of Breastfeeding Medicine that 10 to 18% of U.S. exclusively breastfed newborns experience starvation jaundice from insufficient feeding. One large baby-friendly hospital system reported that 12 to 20% of their babies born developed hyperbilirubinemia of greater than 15, and that 10.1% of those newborns were admitted for phototherapy. That's over 10,000 babies in 3 years. The scientific literature has shown that by the time they meet criteria for phototherapy, markers of brain injury are already present in the blood. How many babies develop hypoglycemia from exclusive breastfeeding? The only study of healthy term exclusively breastfed newborns experiencing strict application of the baby-friendly protocol, all of whom had excellent latch, looked at the incidence of hypoglycemia within the first 48 hours. This study showed that 10% of all the newborns and 23% of all firstborn newborns developed hypoglycemia of less than 40 milligrams per deciliter. All of this occurring by 6 hours of life. What does hypoglycemia do to the brain? In a study published in JAMA Pediatrics, almost 1,400 newborns with no symptoms were universally screened for hypoglycemia by 3 hours of life, to look at the effects of hypoglycemia on the ability to pass the 4th grade proficiency test in literacy and math. They found that for newborns who developed glucose levels of less than 45, there was a 38% reduction in their ability to pass the literacy test. And for those who had glucoses less than 35 and 40, they were around 50% less likely to pass the tests in literacy and math. These declines in cognitive potential persisted despite aggressive correction of hypoglycemia with IV dextrose and supplemental feeding. What this study says is that the physiologic nadir of glucose shortly after birth resulting in hypoglycemia is common but not benign, and that any hypoglycemia below the critical threshold of around 50 can occur in any newborn and can cause long-term cognitive declines. Newborn lethargy occurs when the brain is no longer supplied with enough calories to keep the brain awake. The most recent article on lethargic newborns who develop hypoglycemia from insufficient breast milk intake suggests that by the time they are found lethargic, they may already have devastating levels of brain injury visible on MRI. This article published in Hospital Pediatrics describes 11 previously healthy term exclusively breastfed babies who were found lethargic from hypoglycemia between the 2nd and 5th days of life. 9 out of 11 lost less than 10% of their birth weight. They are found lethargic, poorly feeding, seizing, hypothermic, and not breathing. 5 out of the 6 brain MRIs obtained found injury affecting a third to almost the entire brain. The babies went on to have long-term neurological disabilities, including epilepsy, diffuse body weakness, visual impairment, and feeding difficulties requiring speech therapy. The effects of hypoglycemia are well known. In a larger study of newborns with isolated symptomatic hypoglycemia of less than 47, 33 of 35 babies had brain injury on MRI affecting every part of the brain. They developed different patterns of disability, which included frank cerebral palsy, as well as deficits in motor, cognitive, speech, language, and visual development, as well as epilepsy. How many exclusively breastfed newborns develop hypernatremia, a condition caused by severe dehydration from fluid deprivation and results in brain injury and increased risk of death in newborns? At this time, the scientific literature has shown that 95% of hypernatremia occurs by 7% weight loss. And at this time, over half of all exclusively breastfed newborns lose greater than 7% of their birth weight. Currently, hypernatremia is considered to be rare because it is not screened for in exclusively breastfed newborns. The effects of hypernatremia on brain development are severe. A study of 116 cases of breastfeeding-related hypernatremia showed that more than 50% of babies exhibited abnormal development by 12 months of age. This is perhaps the rationale for the 2012 update of the American Academy of Pediatrics breastfeeding guidelines, recommending no greater than 7% weight loss in newborns. How are all these complications prevented? By ensuring optimal breastfeeding technique, then supplementing with adequate milk if breast milk is not enough before they develop starvation-related complications. The majority of hyperbilirubinemia, hypoglycemia, dehydration are preventable with adequate feeding. This is only possible with honest infant feeding education on both breastfeeding technique as well as the signs of infant hunger and insufficient feeding when supplementation is needed. This includes teaching all mothers that supplementation can prevent brain injury when breast milk is not enough. We need hospital infant feeding policies that prioritize infant safety and prevention of feeding complications over the goal of exclusive breastfeeding. Furthermore, we can protect an underfed breastfed child with supplementation while still maintaining the stimulus required to produce breast milk. How do we change infant feeding standards to prevent feeding complications and perinatal brain injury? Preventing injury to the brain and vital organs by closely monitoring feeding are literally the most important things we can do to protect the health of babies. The consequences of crossing the starvation threshold are irreversible. Supplementation before crossing that threshold is one of the most cost-effective ways to protect infant health. We need to update the message being taught to mothers all over the world to reflect what the scientific data says about the realities of breastfeeding, the math and physics of breast milk supply, and the caloric and fluid requirements of newborns, with the explicit goal of preserving the integrity of the brain and vital organs. The biological norm is for breast milk supply to be variable and at times insufficient, especially in the first days of life. The reality that mothers are not being taught is that supplementation can prevent unintended starvation and disability, and that our primal instincts have protected children from those dangers for millennia. Allowing a child to go hungry to achieve high exclusive breastfeeding rates is unsafe and has irreversible consequences, and this is a standard of care that is being promoted all over the world. Most of all, newborn fasting to achieve exclusive breastfeeding represents hunger, thirst, and suffering that every mother has the human right to prevent. Breast milk substitutes in the form of wet nurse milk, sugar water, and animal milk have been used throughout history to prevent starvation when breast milk is not enough. The reality is that insufficient breast milk is common between birth to 6 months in the vast majority of mothers, and only one episode of acute starvation can disable a child for life. We need to openly weigh the risks of supplementation versus the risks of underfeeding when we educate mothers on breastfeeding. The risks of underfeeding far outweigh the risks of supplementation with safe breast milk substitutes. We need to educate mothers about safe breastfeeding, which includes teaching them the signs of infant hunger and distress, when supplementation is needed, and how to preserve breast milk supply while supplementing. They need education on safe preparation of breast milk substitutes for when it is necessary. And finally, if we are going to promote safe feeding for all children, we need to prioritize access to clean water. Teaching mothers to avoid supplementation does not guarantee sufficient breast milk production and can increase the risk of preventable infant morbidity, brain injury and lifelong disability. It has been estimated by human milk investigator Dr. Shannon Kelleher that the prevalence of women who overtly fail to produce enough milk may be as high as 10 to 15%, and that the prevalence of lactation insufficiency may be much higher, as 40 to 50% of women in the US and 60 to 90% of women internationally cite not producing enough breast milk as the primary reason for weaning prior to 6 months. This is not a misperception among mothers. At this time, there is no quantitative data supporting that the vast majority of mothers have sufficient breast milk to exclusively breastfeed to 6 months of age. Low world exclusive breastfeeding rates reflect natural variations in breast milk production in the population, not a failure of education. The pressure to achieve exclusive breastfeeding is contributing to an epidemic of neonatal feeding complications, preventable hospitalizations, unrecognized brain injury, lower academic achievement, and long-term disability. Publicly acknowledging the common problem of insufficient breast milk and the importance of supplementation to protect the brain can prevent millions of complications, hospitalizations, and newborn injuries. We are asking the WHO to assist us in making infant feeding safe for all infants by ensuring that all babies have access to enough milk to preserve the integrity of the brain and vital organs. Being fully fed is a basic human right that is not currently met by the standard of care. It is our hope that the experts present can come together to critically evaluate the current standard of care to prevent and eliminate these unacceptable outcomes.